we suffering from that one in our community, in everywhere now there is suffering too much people related to heart health. First, we have to think about why we getting this so much problem for the heart, why heart is coming so weak. Reason is so many. Main reason we talk about today. Why people people don't know they're doing that mistakes. They are unaware. There's so many treatment about the heart, but not so many education given about the why heart is getting these kind of problems. Usually 50, 60 years ago, 40 years ago, and 30, 35 years ago, there are not so many people suffering from the heart. Now, why they suffering so much? Because lifestyle is changing, number one. People have a lot of stress. People have every kind of stress they now have, people. But people ignore their health. When we have a lot of stress for the run the family, mortgage, this thing, that thing, then people giving their time, not giving it to their body, they're giving time to the how can we survive. This is one thing in my knowledge, what I'm thinking. And people, when I meet the people have the heart problem, weak heart, or so many after heart, they coming to me and say, what can we do this one now? But already the system and heart was damaged very quickly, because heart is the organ, is the most important organ in our body. If heart is stopped, then person is finished. We have to look after more our heart, but we looking after our lifestyle, looking after our what we need, that one. This is the most biggest problem. Most of people do it, not one or two, but some people, they're surviving because they do some exercises. They don't have so many other problems like people have the smoking, drinking, late night sleeping, and so many other problems. If they look after, don't do that one. And secondly, few things I want to discuss on that one. The people eating too much outside food. That food is all cooked in the aluminum metal. And we don't know how long they cook and keep in that one, because their cheapest pans are aluminum pans. And if you try at home, try and leave the food even after the cooking, you can see the food colors change. All metal go into the food. Lot of plastic we start using last 30, 40 years. That's the reason we have the problem, this one. So many, all the metal going in our body, and people start feeling weak. And this is the reason, when they're feeling weak, the people go to the counter medicine and ask the people, other people, what we can do it. I feel weak, I feel tired, I feel I can't sleep properly, I have some problem, health problem. They go to the, without consulting to any professional, they are going to see the chemists on the counter medicine, we call that one. And from there, they are, what they do, they on the counter medication, they're taking, without consulting, lot of minerals, lot of multivitamin. And in multivitamins, many company are, people, second mistake when they go there, they find there what is the cheapest multivitamins there. They think, oh, multivitamin is a multivitamin, this is. So many things we unaware what we eating. In multivitamins, most have all kind of the metals inside. People are, they don't know, unnecessary they're taking the metals inside the body. Unnecessary you're taking the multivitamins. That's no good for our body, because our body in food also pesticide. In the food we getting at the moment from last 30-40 years in the market, they all food are growing with the pesticides. Air is polluted, our lungs become the problem. All that blockage in the lot of blockage in the lungs, also not giving enough good oxygen to the heart, to the blood. So that reason also heart also starts suffering. When heart starts suffering, we should straightway tell your doctor, check up. We don't even check our blood pressure. At least once a week, we should definitely we have to check our blood pressure. Then we can see what is the rhythm of our heart. But small problem we are ignoring, and one day become the big problem. These are the and other things. What we doing? Eat the toothpaste. So many. They have so many other things. In the early morning, we're taking that one, and also we're going every 2-3 times to the dentist, and also that become the problem. And some filling of the in the teeth filling, that's also go the mercury inside. Many area water are polluted, mercury and arsenic inside that one. These are all we drinking, everything we, and they have the solution in the Ayurveda, but people taking that one, all these kind of things, and small symptom when they get it for the first symptom, any heart patient, you can see if you ask the question when they come to me, they all have the digestion problem. Heart is not come the straight way. The people metabolism come down, liver come down, and these kind of things, as they not sleeping properly late night, that one going to party, this thing, that thing. These are all affecting the lungs. Our lungs and heart both are very much related. They're working together. Lungs is the main supportive organ to the heart. If lungs is healthy, blood is healthy. If blood is healthy, heart not suffer unnecessary. A lot of people get the shock, depression, anxiety. They are all reason to make the weaken our heart. These kind of things we should have to learn. How can we control these kind of things? How can we to don't take these kind of things? How can we prevent our heart from these things? People, they don't know how can you do it, but they working, and at the food, they not the fresh food they eat at every day. Some frozen food as a long time frozen food. Oh, take it, no problem. We don't know. And many, I know the people, when I ask them, oh, they defroze and again they put it in the nowadays in the market or small shops and everything. They're doing like this one, and the people are non-vegetarian. They also have the problem, because all the non-vegetarian stuff doesn't matter anything. They are also eating their food in the fish. They have the, because water is polluted, fish eating that one, and the lamb or anything, chicken, everything, they're feeding the steroid to them. Those all kind of material going in our body, too much steroid, too much antibiotic, too much painkillers, making our system. And after the lungs, we have the other organ is liver, then kidney. One livers have the problem, they start protein and other things throwing to the kidney. Kidney also have the limit. We kidney then stop cleaning properly, and these kind of the all problem suffering heart then starts suffering, because blood is the same. We can't change the blood anything. We can't do anything. Only we can do is, my voice is coming?
Yes, it is.
Oh, sorry, there's some problems come on this one. So these are the things no one told to how can we live in this world now. We can't do too much for the what is going on in the whole world, but we can look after our system regularly, check up regularly, check your blood. As I say, only the solution I say, always say to any my patient, any my video, you have to go and check once a year your blood check. Then you can find what is going on in your body. Other organs also responsible for the heart failure, heart problems. These are, we have to be careful on that one. If we don't careful that one, and the problem is heart issues to getting more and more anything. Lot of medications, before you take it, we have to read the leaflets on that one. What they're doing, what kind of toxin inside that one, to try to avoid these things, unnecessary medications, unnecessary painkillers, unnecessary go to the for the parties, or drinking too much, smoking. These are all making lungs weak. Lungs, then liver is also biggest problem. When they come in the problem, then heart is definitely get in the problem. Sometimes you have the anxiety, sometimes you have the depression, and also shocks. Sometimes we can't handle some issues, and then we are suffering inside internally. So you have to manage that one. No one can do help on that one. We have to manage these things. If we can't manage these things, then all the strain go to the heart and brain. These are the main problem. When we silently suffer that one, silently keep ourselves, not manage these things, then our body starts suffering. These are the, I think, the problems in the body. What we doing, not handling these things, and solutions are what I solution made for that one. Which one is the help the lot of peoples to keep your internal system also healthy, keep the organs healthy, internal system. How can we keep our, because all the other organs when become toxified, then they need to be detoxified as soon as possible. If you suffering lot, then you have, otherwise once a year, if we do the detoxification for the whole body, which one we last week we introduced that one, so full body detoxification, then your organs become like a new again, and then they can start helping to the heart, any kind of inflammation in our body with the toxification. Toxifications, one thing they do, when our body become toxified, they become the inflammation in our body. Like for I give the example, in some area in our home, if we be putting everything in our home, don't take the rubbish from home to the after 2 weeks, now they're coming to collect all the rubbish. If we all rubbish staying in our system, all the things coming, then we can't live in our home. So best way, what is in my opinion, with my what in my experience, that one, what I'm doing, I'm teaching the people, look after your organ. If you feel little slowing down, don't waste the time. Straight away check up your blood check. Even I introduce nearly last 2 years, I'm telling it to my so many webinar, I'd say, make 1 pound a day. They call the health budget. We have to teach our children, our family, 1 pound, make the small box. Tell your children, if we want our children stay healthy, live long life, make the box small boxes and tell them, put 1 pound in there. And you also do 1 pound there. In the year 365 pound you have, that's more than enough for one after blood check and one consultation fee and everything. I think you can look after. Once you start awareness, and also they remind you, oh, this is my health budget. Then if our what we today we video this thing, if you listen once a week or once a month, then you can you know what we are doing, why we making these videos. And thanks Neha ji, choosing the very good subject for the heart. That 365 is more than enough to pay the physician's fees, to blood check, and also the medication. If we do like this one, just need to look after. Nowadays, not like a old time people think, oh, this doesn't matter. Now we have to be change ourselves. Like everything is changed in the world. If we want to keep our heart and lungs and kidney and liver healthy, these are the most important organ. And fifth one is the brain. That 5 organs are most important. One of them gone, then person can die straightway. The heart is like a king of all the organs. They are 5 helping to the whole body. On there, if they are coming weak, there's so many reasons. I told the before video, you can go and watch and other videos. And like I say, the organ and the gland should be balanced, that one. Because when they come problem, this one, then they become unbalanced. We have to do the balance again to work. All the workers start working, then system start, our system become the healthy. And we can prevent the heart disease, heart attack. We can live the good life, healthy life. And so many other reason. If we say, when we delaying this kind of problem, when we got the sign of any unusual sign, I told that if the headache even coming, that the symptom your body something you need your help. If you have the constipation, your body needs your organ needs some help. Why you got the constipated? If the bloating, gut problem, not sleeping properly, these are all the symptoms. The heart is not working properly. Heart, after, if we don't look after that one, then one day all stain go to heart and lungs. Then our heart and lungs once come on that one, that stage is not the simple stage. Then it need a very experienced physician who can look after that one, who can help you to bring back. Before go very much damage, before the heart become the damage like a last stage, please, in the beginning, any symptom you see in your body, go and check up. That is the best way to protect our heart. So this is my suggestion to everybody. If somebody asks the question, is nearly half an hour, as I say, 20-25 minutes I give the lecture. and I can give them more lecture on that one. But people maybe have the so many questions, and I'm happy to give the answer. We have the one is Elizabeth, her partner. She can tell the what is the this is the kind of. She also, when we spoken today, she said yes. My husband had the filling in the mercury is gone. When the filling with the mercury should not be filled. I believe it or not, I never use any toothpaste. I I have the herbal toothpaste, make all the herbs inside, the clean that one. You don't need to go the doctor, dentist. I think last 30 years I never went to the dentist. So we have to protect. If you don't have anything, you have at home 3-4 herbs. You can mix it up with the salt and this little turmeric. That one you can do that one. And even one salt is enough to clean your teeth. Don't go to the too much whitening or this thing and that thing. There's no need that one. If too much chemical, when they go with our saliva, they all go in our body very quickly. So we have to protect that one. Our teeth, our organs, that's the most important. If any other question anybody have, I'm happy to try to help them, give them answer.
Dr. Singh.
Yes, sir.
This is Hasmukh Patel. I'm calling from Toronto, Canada.
Oh, hello, Canada. Thank you.
Yes. So I've been listening to you. You made some very good points.
Thank you.
About detoxing and having a healthy lifestyle, diet, and so on.
Yeah.
So my situation is I have atrial fibrillation. So I have fluttering of the heart, fibrillation of the heart, so palpitations of the heart. And my question is it possible to cure this condition by doing a detox of the body and changing the diet, or do you have any other suggestions?
Atrial fibrillation is the problem is come like when your body is not working properly and lungs are not working properly. I don't know, you have the many people who got that one, they have the so many reasons what is the problem has come like that one. Their heart, the valves are become the problem. They have the 2 valves on the up to, we have the 4 valves in our heart. And that one is how much damage is that one? When is damaged that one? Number 2. And what you taking about that one? What medication they prescribe for you?
Well, my cardiologist has prescribed beta blockers. So I'm basically taking a beta blocker. I'm also taking a blood thinner.
Yeah, blood thinner. Yeah, mostly they're giving blood thinner because that valve is not closing properly. They become the swollen. Inflammation there. That is your heartbeat. How long you have this problem?
For about a year, since last August.
A year. How old are you, sir?
I am 71.
71. It's okay. It's not. But this one is mostly people. Are you drink sometime or not? That one alcohol?
No, I don't drink any alcohol, and I believe we eat very healthy, quite healthy. But I had a stroke last August, and they said the reason.
This means you have the blood pressure.
No, I never had a blood pressure problem, but I got a stroke because of fibrillation of the heart.
Okay, yeah, okay. That's all. Yeah. Then maybe you are on other medications. Maybe you have in the family history of the heart problems.
Yeah.
There's so many reasons, Hasmukh bhai. They need to be asked the more questions, and this one is repairable, and we can, with the Ayurveda, we can repair it. I have to find out what kind of other problem you have, the liver problem or anything, kidney or anything, creatinine is okay. So many things we have to find out. If the creatinine has gone very high or EGFR, your kidneys are okay?
Kidneys are okay, creatinine is okay. The blood tests show everything pretty normal.
Okay.
So,
You have any stress?
sorry, what?
Any stress or anxiety?
Stress.
Well, not too much, but maybe a little bit anxiety now and then. But,
Maybe if you are very sensitive, then small anxiety can damage your heart.
Yes.
Depend on the people. Some people think only 2 minutes, then go forget it, and some people little things they keep years in their mind.
No, I don't have anxiety of that type.
Okay.
I'm usually quite stress-free for the
Okay,
most
that's
part.
very good.
Yeah.
That's very good. But have they told you what is the reason of your this problem? Artificial, that one, atrial fibrillation. What's the reason?
Well, the cardiologist says I have, they call it a sick sinus syndrome.
Okay. Yeah,
The
sinus
signaling.
is
Yeah,
the problem.
yeah.
So mean your lungs is not working properly very nicely.
I don't have any breathing problems, but
No, breathing problem is different when you have the short breath.
not normally, unless I'm doing something physically very demanding.
Okay, what
I
work
don't get
you
short
do?
of breath.
Retired.
I'm retired, yes.
No, what work you do the job? What was your job?
I'm an accountant, chartered accountant, so.
Oh, your accountant,
Yeah.
okay.
Yeah.
And sometimes the jobs are also make the lungs weak, and the blockage in the lungs, the oxygen is not going enough. Most of the problem, this one, is coming, this one, arterial fibrillation, is people have the not good oxygen their lungs making. Then they become the valve become the problem. So in the Ayurveda, we can repair this one. That inflammation we can bring down. Okay, we have the medications. This one,
Okay.
maybe your cholesterol and triglyceride is okay.
Yes, they are. Yeah, I'm taking statins for that, so I'm okay with it. Yeah.
The statin is also the not making, they making the problem to the too much blood thinner is also become the problem. The inflammation artery become very dry and stiff. How long you taking statin?
Last maybe 4 years, 5 years.
Yeah, this is the 4 year. What dose you taking?
How much, or
Yeah, what dose? What is the dose?
5. I used to take 5 mg, but after my stroke, they increased it to 10 mgs a day.
Okay, so you can take the telephone number, because there are other also so many people there, and we have the only 1 hour program. You can take the telephone number from Nehaji, okay, and we can talk later on, okay. And
Okay.
I need the more detail of your system history, okay.
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 Thank you.
Much.
Dr. Avtar, it's Ella.
Hello, Ella.
Just for everyone's information, Dr. Avtar's link to Instagram profile, his website, and the telephone number, I have posted in on the chat.
Oh,
so
yeah,
if you open
thank
the
you.
chat, you can see that, okay?
Okay,
But also, Dr. Avtar, if you don't mind, just to echo from what you've said, there's a number of key reasons why the metals, particularly metals, accumulate in the body.
Yeah.
And what I personally have found after doing big research is that water is very often contaminated with metals.
Yeah.
So, particularly with lead, arsenic, and mercury.
Yeah.
Some of the food is very polluted, particularly fish. We all know about the mackerel being polluted with mercury, but other fish are also polluted. We know that some people pride themselves on being vegetarians, but it all depends where the vegetables are sourced, because particularly leafy greens vegetables, if they grown inappropriately or in very commercial scale, they can accumulate large doses of arsenic.
Yeah. Yeah, I mentioned this one. It is the lot of water, arsenic, and because all the factory, you are right, 100%. All the factory, big factory, they have the lot of chemical. They all putting into the water. Then water go to the everywhere in the soil, in the sea, in the rivers, and where they make all the source go to the soil. Then all these things we are eating now in that water, polluted water, that all arsenic and other metals inside. Definitely, you are 100% right, Ella.
And also, I'd like to add, let's not forget about the air pollution.
Yeah.
I mean, we also have not just from the cars, but also from planes.
Yeah.
And I don't know if you guys know about the things like chemtrail, which they patented. We know that they exist, so it's something very interesting to research about and how it impacts, and particularly Europe is very common. But what I have learned on experience, and some of you who attended a couple of weeks ago when I was here and telling you about the case of Michael, and going back to that example, the reason Michael's body was highly polluted, and it was highly polluted with metals, particularly with mercury, it was from his amalgamate tooth filling. And I would really encourage everyone to find a good dental practitioner to check the state of the teeth and if they have amalgamate fillings. And if you can safely remove, and I underscore the word safely remove, not just with any dentist, but safely have them removed, because every time, if you do have amalgamate fillings and every time you bite, you release small doses of mercury to your body.
The lot of fillings they make with the mercury, and that go in our body, then mercury never dissolve anywhere, and also other metal, mercury can absorb other metal inside the mercury, then become the big problem in the blood.
Yeah, and every time you bite, there's this gentle mercury vapor that is released to your body. You can research it yourself. You can go even on YouTube and see research for movies that to show you in slow motion how that vapor is released every time you bite. So yeah, with Michael, I mean, I was fascinated when we first went with Michael to see Dr. Avtar. And obviously he analyzed the blood test, but also from a pulse reading, he straight away just said, too much metal. He said, where did he get the mercury from? And straight away we knew that was from his amalgamate fillings, which was, even though it was safely removed a few years prior that, the accumulation of the mercury in the body was still very significant. So yeah, I really, really encourage you. Another thing, which is from my own experience, I don't know if you can see, but I don't wear much makeup. In fact, I don't wear any makeup. And I'm very often being challenged, why am I not wearing makeup? And one of the reasons, amongst the many, many reasons why I don't wear makeup, but one of the reasons is that if you research it well, you will find out that cosmetics, lipstick, a foundation, they also contain heavy metals. I mean, a few years back, there was big thing about cosmetics of certain brand. I don't want to name the brands here, but one particular very popular brand, lipstick, was very, very heavy with lead and was actually withdrawn from the market for that reason. So particularly ladies, if you do wear makeup, I would encourage you to research how much metal it is in the cosmetics you wear, and if possibly switch to natural, organic, as carefree made cosmetics as possible.
I interrupt you. I tell my patients only, maybe because people are using makeup, if they stop the makeup, maybe 1 or 2 months, they feel bad. After 2 or 3 months, their skin naturally, which one is glow, that's unbelievable.
Yeah.
And if there's no need makeup, body need internal system should be clean. Makeup is, the meaning is something we don't have, we making up that one, to showing off that one. But a lot of people now, especially ladies, they do lot of makeups. If they avoid, that is better for their health. And as you say, this one, there's definitely all the makeup, they're using lot of metals inside, lot of especially metals like you say lead and mercury and other kind of so many things they're using. They're not telling anybody what they're using, but they definitely many things which one is not suitable. I say only this one. We can't say so much on this one. Not suitable for your body.
Yeah.
Our body automatically glow when we are inside healthy. Our organs are healthy, like I told you, then we no need any makeup. Its natural beauty is most is good for the human body.
Yeah. Also, while we're on cosmetics, the nail varnish contains really high amount of toxins, and some research shows that it's as quickly as 20 seconds from the time of painting nails, the toxin contained that are in the nail varnish get into the bloodstream. So it's actually like incredible how much we can poison ourselves. And of course, when things get toxins and metals get into our bloodstream, as Dr. Avtar explained, then they can accumulate at the weaker points of the blood system.
Now you done good homework, Ella. Thank you very much.
I do listen to what you teach.
No.
Also, another thing I think is very important, I think is very common, but once we're on the subject, it's very also important to add that smoking, tobacco, cigarettes, cigars, they are very, very highly polluted in metals. So if anyone may be an active smoker, but also a passive smoker who doesn't smoke themselves, but is in a company with someone who smokes, you still inhale those metals. And that may be another reason why you might have problems with the heart, because that will be driven by the problems with the blood system.
Yeah. This is so I put it the which one I teach the Michael, that exercise.
Yes, I've seen that on a Q group.
Today, maybe all the participants when they go there, that exercise I designed specially for the Michael when his lung problem and heart problem, that one. And the help to the Michael, you know very well that one, how much is the help that one. If everybody can use it, but use it very slowly, not hard one, okay? Then this one, our oxygen become more. Than oxygen also is clean from the body. Many things they can throw it away. Our body is very strong, very intelligent. But when we not look after our internal system, then they slowly build up. When they too much build up, then our organs also can't do anything. Then you definitely need the treatment for that one, to someone is clean your system, make to workable again. All the I can't say the depend on the person what kind of damage they done and how long, but is Ayurveda can help make the person's life completely cure and also livable life.
Yeah.
If you damage too much, then still we can make the life livable, which one is like a stage 4 to come back to this one. If the person look after follow the Ayurveda system of what I designed, then they definitely the person can leave all the medication, no need all the medication, no need the blood thinner. You got the very good experience for the, you can tell about the Michael, and also aneurysm, what they coming down now in the that one, and all the inflammation what is came down is nearly finished now, that one.
Oh my God, I say that with pleasure, because I just love saying that to everyone. So I don't know if anyone who hasn't been on a session a couple of weeks ago, when I was saying about the Michael's case, my partner who ended up under doctor's aftercare due to the blood clot on a right entrance of his lung, but also he had a aortic aneurysm, and that was measuring 4.5 on 3.9 centimeters. That's what the CT scan of the lower pelvis, of the pelvis and lower abdomen showed in March, 9th of March to be precise. And then we went in June and on the ultrasound test, and the practitioner was looking for the measurements of 4.5 and couldn't find it. So what only found it 3.9 measurement, and was like really confused, thinking that there's something wrong with the equipment, and sent us a few weeks after that, I think 3 weeks following that, we had another appointment in different hospital, and the practitioner said to us that, oh, I'm looking for the measurement 3.9. And it was just, for us, it was joy, but for the practitioner, it was a bit of a shock because couldn't find that measurement, only found the measurement 3.6, which is indicator that as the time goes by and Michael is under doctor's after treatment, the aneurysm is getting smaller and smaller. So I made my own calculation that according, if I'm right, in the speed the way the aneurysm, Michael's aneurysm is disappearing, I reckon by end of March, Michael should be clear of the aneurysm. So this is challenge I've put to Dr. Avtar to prove me that my calculations is right. And I'll be more than happy to share early next year how we're performing. Mind you, I can keep you updated as we go along. But
waiting for the March. Okay, which way you following my instructions? I think within 2-3 months we can clear this with that one.
Well, hope so. We're on the repair stage now, so that would be good. But yeah, I can't emphasize enough how beneficial the treatment from Dr. Avtar to Michael's case is, and obviously for me as a student and as a learner from Dr. Avtar. So yeah, I just recommend it from the bottom of my heart. Changing subject now, Dr. Avtar. I can see there's some questions on the chat. There's a question: is it okay to use steel utensil for cooking? So I'll let you answer that, but before you speak, I quickly say what I do. I personally don't use any steel utensils. I use I forgot the name, so I won't tell you the name. Enamel, that's the one. Enamel. I use enamel, a certain grade of enamel dishes and pots. I also use some of the glass pots to cook, but I do avoid Teflon because that releases a lot of toxins to food. And I also avoid, like Dr. Avtar said, aluminium and lower grade quality of the metals. So Ranjan, I hope that answers your question, but Dr. Avtar, do you want to add anything to that?
Yeah, this one, these kind of all metal with the aluminium is involved. In the old time, people cook in the clay pots. Okay, you can use the clay pots, and the other one they call the an old time we use in the Ayurveda, they call from the iron pots. And also nowadays they make it some glass dishwares, and you can put it on the fire and you can cook in that one. I think that one is okay, but avoid and especially one other thing I say, some Teflon coating is a problem maybe, but most of them they come on the aluminium. But many people, I say, okay, if you're using that's good non-stick one, but if any one break inside, stop that one, throw away that one, don't use again. So avoid maximum this kind of silverware is aluminium we call involved that one. Try to the stainless steel is better. You can cook in that pots nowadays. The stainless steel is not come any the metal inside your food. And also, which one is still this? If you have the teeth problem, you can do the clean the teeth or something, but don't do the fillings. That is the biggest problem. People get or don't take the metal too much multivitamins. If your body is not supporting you, if your health is okay, you no need any minerals. You no need any vitamins. Your body do some exercise, look after yourself. You can do your own massage. I said, don't go to the massage. Do your own massage. Then your whole body can start movement and everything. That's more better than to go somewhere. Like it is the old time in the Ayurveda say you have to do once a week your massage with the oil, full body. That's enough. And when we doing our own massage, our body's movement, everything goes this one, that thing, back, everything. So our body's organs, also joints are become the healthy. And try to avoid the, as you say, this one, you done good work, that one, and you done good research, that one. So please carry on like this kind of research. And what you said about the ladies makeups, that is also I was not said this one. You done this one's good job. You add that one inside. Okay, you're doing the good work, Ella. You doing start. You are researching on. I'm really happy for you. So this kind of thing, you have to think about yourself now and do the study.
A good student can become if there's a good teacher. So thank you to you. Okay. But then there's a question also from Orvashi. I hope I pronounced your name correctly. Ella, what do you class as low-grade metal utensils, please? So, I mean, I've worked in a military and aerospace, so I could talk about the metal grades for a long time. However, just to talk the language that everyone will understand, is I'm not trying to sound snobby, but if you find the cheaper utensil it is, they tend to be done with a lower class, lower grade of metals. So sometimes it is worth purchasing one or two pots, a little bit more expensive, but of the metal, either stainless steel or enamel. And as Dr. Avtar said, if you get in cast iron pots, then soon as there's any cracks, to dispose them because they start leaching metals into food. So I hope, Orvashi, that answers your question.
Good.
There's also a question.
Thank you, Ella. Thank you, Ella, about the question about the water. Sorry, using steel utensil. But is it okay to drink boiling water? Boiled water, which is boiled in the steel pan. Is it okay to drink that?
Yes, but not too much. I always say to the people, you can drink that water. Once you boil it, you can keep it in the one bottle or something. But don't drink too much hot water inside. Take it that one. Because we already have to drink too much hot water all the time. Room temperature is best. If our already in our body the 36.5, 36, 35, that this one blood, if you were drinking water straightway to the link to the blood, and we giving the more heat there, that's no good. We have to be just room temperature, not very cold, not very hot.
Thank you. Thank you.
Water is better.
Thank you.
I have a question about cholesterol. What causes cholesterol, and what are the remedies as far as Ayurvedic medicine is concerned and the diet?
That would be that's a good question, and I think that would be a good idea to cover that on the next session, Dr. Avtar. Do you think?
Yeah, this is the cholesterol is, who have the cholesterol problem, depend on the what is the cholesterol level is going. If you're taking medication, I don't say it's good for you take the medication too much for the cholesterol. If the cholesterol should be stay in the limit, If they come very down, then your body arteries become the stiffness inside, become the very dry. The blood flow needs some kind of lubrication in all the arteries, that one. If they're too much low, that one is also the problem. Nowadays, they say that, but according to Ayurveda, we think differently. Cholesterol is different types of cholesterol. Some is stickiness. I think, Ila, you remember when they done the blood stickiness, the check
Yes.
for
Yes, so initially, before your treatment, particularly the dimer was 2.2, so it was high, and the blood was very sticky. We're talking, when was this test done? It was done in June, middle of June. So 3 months later, the blood wasn't sticky at all.
Yeah.
And the dimer, which is the indicator of if there's still clot, which is the indicator of the aneurysm, halved. So it was 50% less.
Okay, I tell you one thing. The reason why I ask you the question, sometime when you come for the medication, that stickiness make the clot.
Yeah.
That stickiness make the arteries blockage. In our blood, if that stickiness not taken off from our system, the stickiness not in the blood, stickiness in our bodies, everywhere. That stickiness, when we not look after, our blood is throwing in our body, like people have the Alzheimer, anything. People ask me, how you done the treatment? I took that stickiness with the Ayurveda medicine, what I designed. All stickiness, when they reduce, they automatically inflammation is reduced. Aneurysm is also like the one side support is come, that clot, and they becoming stick on that one, becoming bigger and bigger. That is an allopathy say, no, they never reduce. But this is reducing that one. Maybe one day they believe this one. And what I done, I taken that stickiness off from the body when I done the full body cleansing. Cholesterol is not the big problem. Problem is why our body start building cholesterol. Because liver is become fatty. Definitely who had the cholesterol problem, maybe they have another problem. And just only cholesterol is not the problem. Never have single issue cholesterol. Maybe they have any medication. So I don't know the madam who asked the question, this one. So we need why is it only cholesterol is high, or the other issue you have in the body?
The other things I have is high blood pressure.
Yeah.
Now the doctor for the cholesterol, the doctors asked me to suggested I take statin, but I know I decided to leave it out for the time being before doing my research and finding an alternative. Do I really need to take statin?
Okay.
In the reading, the total cholesterol is 5.87.
That's not the big problem. Can I ask you what range your blood pressure go high without medication?
Without medication, it can go up to 170.
Okay, hold on.
I'll be 67 in 2 weeks.
Okay, no problem. You are nearly 67. Okay, and
Yeah.
if go 170, if they go reason of the stress, reason of the you are overweight, that is different. You have any appetite problem?
Appetite means I have been fasting this holy month as much as I could. And now, because of my teeth, I decided not to fast the two days yesterday, Monday and Tuesday. But I am slightly overweight, not very overweight.
That doesn't, slightly is okay. What is your name?
My name is Mayuri.
Mayuri.
Yeah.
Don't worry too much. 5.7 is not big problem. Okay. Now the allopathy, they nearly 30, 40 years ago, there was different range. Now it's different range. Okay. And cholesterol is not big problem according to Ayurveda. The problem is why your body, most of the problem, cholesterol, liver can handle these things. Never come the over. If we eat, doesn't matter what we eat, and liver can means your liver is fatigued now. Have you checked your liver?
No.
Now you have to first thing to do it. Do your full blood check. Okay.
Yes.
But don't take the unnecessary medication. We don't need medications. We need to look after our organs and look after our liver, heart, and lungs. As I told you, these 5 organs are most important organ. Other organs are like helping to them. Kidney, lungs, heart, brain, and liver. They are most organ. One of them become the problem, then everywhere problems start going that one. So anything become once a year, as I told you before, please do once a year, everybody. I request to everybody, once a year, do your full blood check. And we can post we designed that one, and we can post in our group that one, what kind of blood check you need. Okay, take it from there. Go to any to your doctor if you do it. If your doctor don't do it, do the privately. There's so many labs, they can do it that one. Definitely do it. Then you can take medication. Otherwise, there's a reason something else, giving medicine something else. Blood thinner is not the solution for anything. Blood thinner, that if the arteries are blocking, the one day they build up more. That scale in the artery, what is the build up, that's never reduced that one. They go day by day. They're making blood thinner to pass on your blood from there. Your blood should be healthy. If there's too much thin blood, then one day become more problem. Your brain, maybe you start losing your memory. Your memory is okay?
My memory is slipping slightly.
Yeah, it's coming down. Eh? Hello?
Yes, my memory is slipping slightly.
This is the benefit of the statin. Okay. If you do the too much blood thin, or blood pressure medicine also do the blood thinning. And blood pressure, I told you, you see my other videos, and blood pressure is not the disease or anything. As I told you in the first video, there is no any disease. I don't believe. Only our body is unbalanced, then they start giving symptoms. If your blood pressure is going high, that is a symptom your arteries are not working properly. They are not balanced. And I never give any my blood pressure medication to any people. I don't do their system to make the balance, then blood pressure automatically go down.
And for cholesterol, do you think a liver detox will help?
Yeah,
and what can I use for a liver detox? What can I use?
Not only liver detox. If you have other issues, first you do the blood check, as I told you. Then you can find what is the problem, which organ is going slow down. That is the best thing to do it. Okay. Then you see any physician, which one you think is good. I told you about the physician. Also, I'm educating our group. Take your blood report, go to the physician. If physician can tell you 50%, you check your pulse and everything, 50% your symptom and anything, then he is the good physician. If he can't tell you anything, that means he don't know anything. You have to find the good physician, which one know the job. Then you can get the benefit within weeks. Okay. If you don't have any serious problem, within 2-3 weeks, you can do your, like we do we not do the panchkarma. Panchkarma is only do the stomach and intestine, or like this one, they do some sirodhara, this thing. But I designed the one full body cleansing. and that work very much similar. We not give any woman, not any brechen, not any anema. That's very simple to take it and start giving the result within 1 week.
Okay, so what can I use for liver detox? Is there any Ayurvedic medicine?
As I told you, if the liver toxified or not, maybe you have the gut problem, maybe you have the other problem, and this one you take the blood checkup, and then contact. You can take the number. I can't say that take this medicine. Maybe your liver is not only liver, your gut also have the problem. Okay.
Yeah.
You have to do the blood check first. Okay.
Okay, and the result of 5.7, the cholesterol you said is not too bad.
It's no 5.5. They say the 0.2 is nothing, not big thing. Okay, but
yeah.
It's not coming in the control. That is the issue, and that mean maybe your kidney is not functioning properly. You have the less urine passing every day. Are you pass the less urine?
It's probably because I don't drink much water.
That is the so many other problems. Then you need the any physician consultation. Okay, there's so many things you if you're not doing, you have to find the life who can tell you the what you do, what you not to do it. Okay.
Yeah.
Okay.
Okay, thank you.
Thank you very much.
Is it I wanted to ask you one more thing. I've got a copper bottle or drinking water. Is it safe to drink from a copper bottle?
Copper bottle is okay in the Ayurveda. Copper bottle is very good. Copper or clay pot, you can put the water every night in the clay pot and you can drink that one. No problem. It's good for that health.
Yeah, but if you have thyroid, can you still take water from a copper vessel if you have thyroid?
You thyroid, you know what the meaning of thyroid. I don't know what condition of the thyroid.
Low thyroid, hypothyroid.
Yeah, hypothyroid. What is the range of the thyroid? How long you have the thyroid?
No, I have a thyroid. I take 50 micrograms of levothyroxine.
I say, how long you have the thyroid?
Oh, very long time. About 15 years now.
Yeah, 15 years thyroid. Thyroid is not only T3, T4. What is the THS level? That one. Without that one, this is the biggest problem. This is like a chemist asking the question, go to the chemist shop. Without the proper information, what is your name?
No, my name is Smita, but somebody put a question on that. If you're drinking from a copper vessel, is that good for thyroid? People with thyroid? That's all I wanted to know. I don't want to go into the detail of thyroid.
Okay, then sorry that one. If somebody told you the copper is okay, the copper pot is okay, then maybe he got some experience in a copper pot. The water prakriti become little pitta prakriti. Copper is pitta, that one. If your thyroid is, your body is not have the enough pitta, then it's okay. If I can't give without seeing the vat pitta kapha, what is the balance. If the thyroid is the biggest problem, they are unbalanced vat pitta and kapha. They call tradosh. That is the thyroid organ is become the problem. So if somebody told you, try that one, 2 weeks, 4 weeks. If you feel better, then let us know. Okay.
Okay, thank you.
Yeah, if you try, if somebody told you, better you try that one. I don't only recommend for the thyroid on this condition. So you take the water in the copper vessel. This is good for the health, as I told you. No problem that one to take no water on that one. Okay.
Thank you, Dr. Singh. I'm sure the discussion with you will never ending because we don't want to let you go. There would be many questions, but I have to stop conscious of your time, and you very kindly give us Wednesday 1 hour. We always take it more than